Good afternoon, everyone. My name is Gonzo Rocha, and I am doing another interview for Jacob Lenhoff World Tours. This is my third interview. Very honored to be asked for another interview, and thank you very much for this opportunity. We'll go right straight into the questions again. How long, or I guess, when did I get into EMS? I've been a paramedic since 1990, so 35 years in. I started as a volunteer while I was going to school, and then when I graduated and was certified, then I made it a career and decided that it was time to get paid for it. So 35 years in, with my current employer, I've been here 25 years and looking forward to another 2. And that's it. I should be done and hanging it up. I'm in my late 50s now, so this is definitely a young man's job. Anyway, what was my training like in college? Well, primary care paramedic, your BLS, is a 2-year program. It's the equivalent to a 2-year associate's degree in the United States. Here in Canada, it's very extensive. You have to put a lot of hard work. It's a very strict program. What I mean by that, there's a lot of coursework. We cover anatomy, physiology, pathophysiology, pharmacology. Along with that, there's also other things to study, like rules, regulations, the Ambulance Act, the Mental Health Act, the Highway Act, and you gotta know all these things because you're liable, you're held in sort of like a legal position, I guess. So you need to know what you're doing, you need to know the rules, you need to know the laws. So yeah, it's quite extensive. Along with that, you have rotations or clinical hours that you have to put. So you have to do rotations in the emergency room, in the ICU, in the burn unit, labor and delivery, mental health ward, day surgery, and also you have to put shifts on the ambulance to get precepted so you can get your street experience. The program is very strict. There's a high expectations. You either pass or you fail. And what I mean by that is the grading system is strict. It's either an A or an F. That's it. So, and it's good because you want a paramedic to show up to your house that is competent, knows what they're doing, and is going to get the job done and when it matters the most, right? So yeah, I mean, that's pretty much about it on my training. How many miles do I put on the truck a day? You know, it's hard to tell. I don't know if there's actually a paramedic out there that keeps track of the miles they put. Yes, we put down starting mileage, ending mileage, so forth. Usually it's about roughly 7-8 miles, 10-12 per call, maybe less. Some days, some calls are more than that, some are less. So to pinpoint, I really don't know how much that, I don't know the totals, but it's probably a lot because we do have to put these documented miles on paper, right? So anyway, and we fill up our trucks a lot. What was the first life that I saved? Well, the first life that I saved, believe it or not, was a family member. It was my niece. Haven't kept in touch because she was my niece during my first marriage. But what happened is we were at a family gathering, I guess, remember vaguely, but I do remember that this little child, my niece, the toddler at the time, was choking on an apple. I heard the commotion, the yells, the screaming, the cries, the panic. My paramedic side kicked in. Actually, I was a student at the time, and I learned some skills. I was already certified in CPR by that time, so I ran over there. I grabbed the child from my sister-in-law's hand, and I went into action. Before you knew it, piece of apple was out of her throat. Child was back to crying again because it was a pretty severe choking. There was no sounds coming from this kid. not even a cry. It was blue. She was blue, going very limp. Yeah, so that's one of the first lives that I actually have saved in my career. This is good. Anyway, next question, I guess, that I get is, how many overdoses do you get in a shift, in a day, and sort of what we do for them to try to get them out of this state that they're in? Well, drug overdoses is hit and miss. It is common for you to have an overdose in your shift. Well, let me rephrase that. In your rotation. Sometimes a drug overdose will be on all your shifts. Sometimes you will have multiple drug overdoses on one call, and I'll give you an example. Where normally a call would be a drug overdose, and you find one person who's overdosed on narcotics, etc., whatever drug they chose. Some calls, there'll be a group of friends who want to do the same drug all at the same time. And they all wind up overdosing. And when I mean overdosing, not that they're just sick by puking. I mean, these are full-blown narcotic overdose where they have stopped breathing. Some of them have gone into cardiac arrest. So when we do a drug overdose, we do have a couple of ways that we can bring them out of it. And it all depends on the individual and how far gone they're into this episode. So for example, if we get there, they're unconscious, but they're still breathing and they have a sort of a decreased respiratory drive, then we monitor their vital signs, we monitor their oxygen levels, and we use artificial ventilations to keep that respiratory drive going, and also to blow off any narcotics that's in their system, right? We do have Narcan for the more severe cases, but Narcan is one of the drugs you have to be careful how to use it. It could be a potential hazard to the first responder, because when you bring someone out of an overdose state, I don't know where they go to, some sort of high, maybe they're feeling good, I don't know, but they're dying. That's clinically, they're presenting like they're dying or they're dead. We use Narcan and to bring them out of it. But like I said, you got to be careful, because when they come out of it, most people will come out very violent. They wake up violent. And we have had several paramedics hurt trying to revive some of these drug overdoses. What is the life you saved that is the most memorable? Well, one of the lives that I saved, and I don't like to consider myself a hero. I'm just doing my job. I like to help people on a daily basis. This is why I do this. But that being said, on one of my calls, it was a very bad accident on the highway. There's always bad accidents on the highway. Anyway, the person that me and my partner and the first responders there, because it's just not one person, it's a group of people that make the difference. Yes, being the lead paramedic, you take the lead, you call the shots, but it's a team effort. Like I said, there is no I in individual. However, this person was severely injured, needed a trauma center. We couldn't get the helicopter onto the scene, so we had to drive her to the trauma center, which was, I think, a 20 or 15 minute drive. Normally, it is about a 30-40 minute drive from where we were, but my partner made it in probably 15 minutes. So I think he put wings on the ambulance and jet propellers. But anyway, so we had to go fast. It was a life-threatening situation. Unfortunately, her injuries were not reversed, but she's still around here. She gets to be a mom again. She gets to enjoy her family and her friends. But this person was the friend of a friend. So it was their childhood friends that I wind up helping, saving. But like I said, I use that loosely because it's just not me. It's a group of people. So yeah, it takes a team, right? Everyone from police, fire, paramedics, to the hospital you respond to the trauma team, the nurses, the doctors, the respiratory therapists, everyone, the lab technicians, the medical secretaries, everyone plays a big, huge role in this. So yeah, it's just not one person, and I don't definitely take credit for any of the people that I save, because like I said, it's more than one person doing this. How many calls are actually life-threatening? Not many these days. But it depends on the day, depends on the shift, depends on the time of year. Summer tends to be more active. People tend to go a little more crazy during summertime. You know, there's hot, there's drinking, there's booze, there's parties. People do dumb things when they drink, right? So, but anyway, lately we've seen such a shift, and I don't know why. People aren't using ambulances anymore just for big calls. And what I mean is people sometimes call because they want a quick fix. They want their cold to be relieved right away. Well, no, that doesn't happen. They want their diarrhea to be cleared right away. That doesn't happen. And people shouldn't be calling for an ambulance for that. They should be going to a walk-in clinic, in my opinion. But anyway, so yeah, it depends on shifts. It depends on the day, time of year. Believe it or not, even payday makes a difference. So, but yeah. What are my top 5 most memorable calls? I don't have a top 5. I have calls that I remember, and then some calls that I don't want to remember. I can tell you, saving my niece's life was one of my calls that I remember. Saving my friend's childhood friend is a call that I remember. There was a mom who decided to commit suicide in front of her 2 little girls. We saved her life, gave her a chance to be a mom again, gave a chance to be a mom to those 2 beautiful little girls, and those 2 little beautiful girls got their mom back. So yeah, those things. And unfortunately in this business, there's more bad calls than good calls. So, but yeah, I mean, you always feel good when you are able to give someone's wife back to their husband, or the husband back to their wife, or their grandma back to their children, or the mom back to the children, their families, their dad, giving their brothers back, their sisters back. So you feel good when you've done that. So that tends to be memorable, I guess. Next question. What is the best shift you have ever had? Best shift that I have ever had, like I said, I've been this too long, 35 years. A good shift is when you make an impact on someone's life in a positive way. A good shift is when you are able to sit down and have a 30-minute break and have a nice warm meal. You get to use the bathroom. You get to drink water. Believe it or not, there's lots of days when we don't eat. We hold our tendencies to hold our bathroom breaks till we get somewhere and be able to use the bathroom. Drinking water, we probably dehydrate a lot of the times, but those are good shifts. As far as good shifts that I remember making someone an impact, well, there's been quite a few, and probably too many to remember right off the bat at this time. One of the next questions is, and is this a deep one? There's lots of layer to this, just basically because it was a very traumatic call. It was traumatizing the family, and it was traumatizing to all the first responders that were there. There was this instance or a call, I should say, where we had a minivan rollover on the highway and rolled over into an embankment. So it rolled several times. And it was a deep embankment in that. The passengers in this minivan, mom, dad, and 3 children, nobody was wearing their seatbelts. The children weren't in child restraint seats or proper seats. Everybody in this van was ejected. They were thrown out of the car. The one that I treated, the one that me and my partner treated, I should say, because I was the highest trained on this call, was the 8-year-old little girl. Hard to talk about. I did my best. Her injuries were very much life-threatening. She was alive when I got there. She was talking to me. I looked at her and I knew this was not going to end well, because you have that experience. And when you know it's going to happen, it's happened. I tried my best. She didn't make it. Is that traumatizing? You know, you can call it whatever you want. Did it affect me? Yeah, it still affects me sometimes. I've learned to move on from it. And I guess as humans, we heal over time. I did have some sleepless nights. Every Thanksgiving, because this call happened on Thanksgiving, it was difficult for me to get through that day without thinking about this, remembering her, seeing her in my dreams, in rooms. So yeah, it was one of my most tragic calls. It didn't have a good ending, but you can't save everyone. It's just impossible. How many cases do I do that are actually life-threatening on a daily basis? Well, like I said before, not too many. Sometimes you get them back to back. There'll be days when I'll have a cardiac arrest, 2 or 3 of them in one day. But then there's a day when I do pick up an elderly person who needs to get to the hospital because they need antibiotics and they have a family doctor, right? I'm okay. I'm okay with all those things. But no, the big calls that you see, especially on all these shows on TV, it seems like they do these calls every day. No, it's not like that. In fact, you talk to any paramedic or first responder, some days can be boring. So it's not every day. What is the best shift you had once everything went well? Well, again, like I said, there's shifts when things go well. You don't remember all of them. It's hard to. You do feel good about making a difference in someone's life. And like I said, whether it's you resuscitate them, your first effects of a drug overdose, you were able to save them from their injuries and so forth. So, but, you know, sometimes when you have a good day like that, me and my partner will go get ice cream. We'll get an ice cream cone, like ice cream. Or we'll stop at a bakery. We'll get a cupcake. We'll treat ourselves, right? I mean, you know, far between, but it's good and it's great. Have I ever met someone that I made a difference, saved their life, whatever? Met them elsewhere out of the call? Well, yes, I have. I've met them several months, several years. Some I can't remember. They remember me. For some reason, they remember my face. I guess you kind of in situations like that, you remember the faces that help you. But yeah, and it's nice. It's great. I sometimes have to tell them, can you just remind me where we met or how things went? Yeah, it's great. You know, some of these people are really appreciative of you. They'll bring cookies, muffins, baked loaf bread, treats, pizzas to our base, and we get to enjoy it. Sometimes we take pictures with them. So yeah, it's pretty cool. I like that. After a day's work, what do we do? How does my shift end? Well, hopefully if you get off on time, which is not all the time, but you make it back to your base, you wash your truck, you make sure all your equipment is disinfected and clean, which you do anyway after every call, because it's just, you gotta have clean stuff, clean equipment. We stock up. We stock up on all the equipment we've used, supplies, medications, whatever it was that we used. I personally, after I do all that, after a day's work like that, it's probably best that I take a shower before I go home. So that's how it ends for me. I stock up, make sure I'm responsible for everything that I've used. Then I hit the showers. Once I hit the showers, man, it's like I just relax. I feel good. I feel clean. I smell good. My wife likes that. And I go home. But this pretty much finishes this interview. Thank you, Jacob Lenhoff, for this opportunity again. It's been a pleasure. And everybody take care. Have a great day. Take care of yourselves. Be kind to each other. Take a deep breath. Okay? Anyway, peace out. Bye.